Pain MD podcast is for information, education, and entertainment purposes only. This applies to all information, graphics, videos, and content on the affiliated website and podcasts. The aforementioned does not constitute medical advice, nor does it establish any patient-physician relationship. The information and content on this website do not substitute for any professional medical diagnoses, treatment, or advice. Seek advice from a qualified healthcare practitioner for any questions you have concerning a medical issue, including treatment. Do not delay consultation with a professional or disregard their advice based on the information on this website or podcast. The opinions, statements, and views are that of my own and do not reflect those of my affiliated institutions, policy, or any entity.
Hello and welcome to World of Pain MD podcast, where we discuss all things pain with the experts. I'm Dr. Derek Davis, a PM&R resident who is subspecializing in pain management. In this episode, we explore the trials and tribulations of opening up and owning your own private practice in medicine with Dr. Christopher Williams. Dr. Williams is the medical director of Interventional Orthopedics Atlanta, which practices innovative techniques for treating acute and chronic musculoskeletal conditions. He is a Florida native and enlisted the United States Air Force after high school. He attended the University of North Florida, where he graduated summa cum laude. He went to medical school at Emory, where he also did his PM&R residency. He subsequently completed his fellowship at the Centeno Schultz Clinic in Colorado. He is extremely knowledgeable about medicine. He's considered a thought leader in his field. He's been given numerous awards and accolades, but he's also generally one of the nicest people and very down to earth. Thank you so much for listening or watching. I hope you learned something and enjoy. Well, Dr. Williams, the man, the myth, the legend, thank you so much for being here and welcome to World of Pain MD. I know this podcast is made in many ways to just discuss, aspects of pain, diagnoses, treatments, but I was thinking about it and I think the business and the entrepreneurial side are very important as well, because it's kind of how do you have a business that helps people treat pain? And I know your practice isn't pain per se, but it does overlap quite a bit with a lot of other pain practices insofar as you treat things like the spine, the hips, the knees, the shoulders. So I kind of wanted to get your take on a lot of these things, basically. And I suppose one of the best ways to start it out is just, why did you want to start your own practice?
Yeah, great question. Well, thanks for having me on, man. Again, sorry for being remote in the car. I guess that kind of comes with entrepreneurship as well, but multitasking always. I initially never had the entrepreneurial bug, so to speak, but I've always been, quote unquote, a hustler, right? So always kind of thought outside of the box in terms of trying to approach things differently to get to the goal of whatever that may be. And typically that usually revolves around money. For me, when I was in my fellowship training, which was a combo training of essentially sports spine with a focus on orthobiologics. And, I initially was going to sign up to be kind of a medical director position for a practice that was going to do the startup thing. They were going to front the startup costs, and I was just going to help them manage the practice overall. But that kind of folded when they wanted to go a different direction. So at the last half of my fellowship, I was kind of in the crossroads of, what do I do? Do I look at coming back? I always know I want to come back to Atlanta. So did I want to come back to Emory, try to do academia, which has its pros and its cons? I always enjoyed teaching and working with residents and doing research. So, that had an appeal, but also there was a lot of red tape associated with that as well that was not appealing. I thought, well, why don't I just open the practice that they were going to open as well? So I started looking into the startup costs, some of the regulatory things, and then just, first and foremost, educating myself on operating and running and starting a business, which is different in many different ways in starting a medical practice and just a traditional business also.
So that medical director position, that was kind of attached initially to the business that you were going to start up. Was that like the more attractive aspect for you, or was it the business in and of itself that was like the initial part?
Yeah, coming out of, fellowship, the thing that was attractive initially with that medical director position is it was easy, right? So going into the real world and all the uncertainty that lies within it, it provided some level of comfort and shelter, having a guaranteed salary with the base and bonus structure that was pretty decent. Whereas when you're going on it alone, you have to have a buffer. Typically they tell you that when you're starting a medical practice, plan on not paying yourself for about 18 months. And so that's tough. You're really going to get yourself in some level of significant debt if you're already not there from your medical training, or unless you have a partner that you can, ride that wave and lean on, so to speak, to provide some of the financial resources for the household while you're starting the medical practice up. And for me, I was in that fortunate position. My wife's an OBGYN, so, she kind of allowed me to, take a step back and focus in on the practice. And I was actually able to start paying myself at about, 4 to 5 months with starting the business, with cash flow being in a good space. So it kind of turned around relatively quickly.
And so you were in the Air Force, and thank you for your service. Were there certain daily routines? And I say the Air Force because I'm sure that sort of inculcated in you some sort of routine rhythm in your life. But were there any things that helped you felt like a daily routine that helped you grow your practice from the beginning?
Yeah, man. The Air Force made me relentless, man, to be honest with you. I know that I'm not as punctual as I used to be. Because that is the benefit of being your own boss. You can come and go as you please. But the relentlessness of never stopping until the job is done. Always kind of encapsulated that in how I approached my life after I finished my military service. And so whether that was, medical school, residency, fellowship training, and then into private practice, just being relentless. And sometimes that's long nights. I was up until 6 a.m., preparing my house for staging this morning and still was up by 8 a.m. So sometimes you have to have those sacrifices to get the goal accomplished, right? And not everybody's built that way. You have to be built that way to reach a level of success by any means to a certain degree. So you have to be relentless. Absolutely.
One thing that I thought was interesting that you touched on was being financially prepared. How much debt does one need to take out, or loans that someone needs to take out to begin with? Or I guess, how does one financially prepare? Like, do you think it would have been possible for you to go on this route had it not been, your financial situation with your wife being in practice?
Yes, you just, you dig yourself into a little bit of a hole, but it's nothing that you can't dig yourself out of. So, the startup costs for interventional practice is a little bit on the steeper side than, say, maybe your neurology colleagues, right? Because of the equipment costs that go into it. So, you got your C-arm, for me, I have 2 ultrasounds, and then, the build out costs. And so hindsight being 2020, I could have probably decreased my startup costs by about 50% if I had looked at it a little bit differently. But, as being someone that was coming from fellowship, there were things that I did not know and didn't really have much in the way of mentorship. So I would have gotten refurbished equipment instead of brand new equipment. I would have looked at getting an office space that was already kind of outfitted instead of doing a completely new build in Buckhead in a Class A suite that, the build out was, $280,000. So whereas you can do a renovation for about 60 to 70,000. So, there's things that you learn kind of along the way, but you can probably do it somewhere around 120 upwards to 400 or 500K if you want to get a CMS certified ASC. That's going to cost you some money. So my surgery center procedure suite is not a certified suite, so because I'm cash based practice. So.
Got it. Okay. So it's kind of got to abide by those regulatory laws in order to get reinsurance insurance reimbursements, basically.
Yeah, exactly. And that takes a while. It is, for CMS. So you have the CON rules, the certificate of need for given locations, and that makes it difficult to actually get ambulatory surgery centers outside of a hospital as well. So there's that kind of red tape. And then there are certain inspections and requirements with airflow and the build out requirements that add a significant amount of cost onto it if you want it to be regulated and fall into the purview of CMS to get reimbursement also.
I'm sure that's kind of a scary prospect when already you are planning on not paying yourself for, come 18 months. Then you've got this kind of big holdup when it comes to getting these regulatory check marks as well. But when it comes to initially starting something up, another consideration would be like legal preparation. Was that something that you had in mind to have consent forms, to talk to a lawyer? Like, how did you prepare for that?
Yeah, absolutely. I mean, it's always wise to have some form of, legal counseling from a medical standpoint, from a structure of your organization, whether it be a tax attorney to figure out what's going to be the most advantageous for you, whether it be LLC to S Corp or whatever the structure needs to be. But then also from, like you said, consent standpoint as well, but also CMS, when you're living in that world, you want to make sure, things are above board in terms of having patients fill out the advanced beneficiary notice and different things like that to make sure your reimbursement is not going to be affected, or that you're going to fall into a situation where you're undergoing clawbacks after an audit and having to owe the government money back from that standpoint as well. So you have to be very careful. For me, it's a little bit clear cut when doing things primarily in the cash base. You have to be careful from a legal standpoint to make sure from a consent, perspective that's always kind of black and white and as crystal clear as possible. And you kind of learn that a lot in fellowship, because that can be a daunting piece as well, kind of the legal risk when things go wrong or things happen, as they always do. But yeah, you definitely have to be familiar and aware with that. Fellowship was good with kind of preparing you with that, for that in a certain degree. It's a little bit different and I did a private practice fellowship, but when you're in academia, it can be a little bit different. You can be shielded from those things to a certain degree, and just kind of focus in on the work of things. So try to stay tuned and stay focused in peeling back the layers of the onion of, okay, well, what is the actual paperwork that the patient is filling out, and what does it say, and why does it say that,
When you first started out as well, how did you market your business? How did you make people aware you were here, what you did?
Yeah, man, marketing is probably the most important. Well, the two things for the success of a business, marketing is really one of them, but then also good patient outcomes, which goes hand in hand with marketing. So, the best marketing dollar that you'll ever spend is having a good patient outcome. Because that does better than any Facebook marketing, Google AdWords, etc. But initially I kind of, as they say, pounded the pavement. For my patient, and you'll kind of figure out what your best clientele is. But my patient subset is really the cash-based clientele. So my thought process, well, I need to target other providers that provide cash pay services that can refer to me. So I sought out all the high-end concierge physical therapy practices that are more boutique, some high-end chiropractic offices, the family med concierge docs as well, and then having some good referral patterns at Emory, and still having good relationships there was beneficial as well. So, kind of just depends on kind of which angle you're going to come from. But, having a nice, pretty package put together when you meet these individuals. I did a lot of lunch and learns, kind of educating people on biologics, what they are, what they aren't, who's a good candidate, who's not a good candidate, and when to refer as well. And that really helped to pay some dividends both ways as I established good referral patterns to good PTs and other providers that I could trust, it came kind of both ways, full circle.
And you're talking about lunch and learns. Are you like knocking on doors? Are you sending emails? Are you doing cold calls? Or like what method did you find best to get in contact with the people you needed to be in contact with?
Yeah, the people that were the most receptive initially were the physical therapists. They actually kind of sought me out to a certain degree because there's such a small number of providers doing what I do, that they would come to my office and bring me and my staff lunch and just kind of want to hear what I do as well, because they know that, it pays them dividends as well, because every patient that I treat they always have to do some level of biomechanical work afterwards in physical therapy after their treatment. So that was always the easiest kind of way. I did go out to a couple of practices, with my, suit and folder and all that, kind of doing, kind of cold call, so to speak, and providing some packets of information as well. I don't know that I necessarily found that as helpful. I think one of the things that was very helpful is once you start treating people, finding out, who their therapists are. And when you start to work with people and you start to get good outcomes and their therapists see that, then the therapist becomes a little bit more interested as well. The cold call stuff, I don't find it was as beneficial as just kind of word of mouth, and people having had the treatment, having good outcomes and working directly, with the therapist one-on-one and kind of being the proof, so to speak, of the outcome.
When you first started up, did you establish for yourself, these are my 5 and 10-year goals? Did you think about it kind of in that aspect, this like future, this vision you had? Or did you say like, I just want to, get boots on the ground. I want to start this thing?
Yeah, I think you always kind of have to think about, short, mid, long-term, and end game off the onset, right? So that way you can always be thinking about an exit strategy. Initially, I wanted to ideally be able to pay myself a salary within 12 months. And then the next goal for me was I wanted to be able to collect $1 million in revenue for the year. And then after that, the next goal was I wanted to be able to grow my practice and either get a second or third location or have more providers in-house, which then you have to be forward thinking when you're doing your initial build out is how many providers do you want to have under the same roof as well. And I found out, kind of just thinking about it and experience and talking to others, it's much more cost beneficial when you grow your practice under one hub than trying to, branch out into multiple locations until you've maximized the office space at one location first, because the overhead is significantly more per location than adding a provider at one location, right? And then also kind of looking at, how long do you want to do this, right? How long do you want to be in private practice, be an entrepreneurial and practice owner, and how long do you want to be in medicine? And then you kind of backtrack from that to be able to come up with the strategy can allow you to hit those goals as well,
Was there ever a point that you looked back and were like, I have made it? Like I achieved all the things that I wanted to, and you felt like a success?
Yeah, man, there are several, because like I say, man, coming from where I come from, man, growing up dirt poor in public housing, just being able to finish medical school is not something that, my cohort and people that I grew up with has done. So, the people that I know growing up, I'm already a celebrity in their eyes, but my own personal, idea of, success and making it, I feel like once I was able to finish my last textbook, that was kind of like the ultimate cap in the feather for me, because I didn't feel like, I feel like I had already made, Emory 40 under 40. I had published a decent amount of articles. I've lectured everywhere. and I've written essentially the standard textbook on this field, as one of the main editors for it. So I felt that, I could go on and feel comfortable with pursuing other endeavors outside of this field or medicine without feeling like I didn't leave any stone unturned, and feeling complete, to be honest with you.
So it was almost some academic, it wasn't a financial goal that you achieved that you were like, I made it. It wasn't like a throughput for patient, visits. It was some of the more academic accolades that you were really proud of.
Yeah, I think those stay with you, man, because I just ultimately have come to realize that, you can't put a lot of stock into things that are fleeting, that will not remember you after you move on, right? So, your ultimate legacy is of your friends and your family and your loved ones, your offspring, etc. And so for me is I just, the type of medicine that I do, excuse me, is not, I'm not, if I wanted to do it strictly for monetary reasons, I would not be doing it, right? There's many different aspects of medicine, or just in general, that you can do that would be much more lucrative. But I do enjoy the satisfaction of being able to help people and give them long-term relief and better quality of life, and just being able to be a stepping stone for them to be able to reach some of their goals in life as well, whether that's just being able to walk or play with their children, or attend a graduation, etc., and have those relationships with patients where patients just text me and call me and ask me how my family's doing and stalk me on my social media as well, which is rewarding in and of itself,
Yeah. Yeah. I gotta say, just even spending one day in clinic with you, because of the nature of what you do and it's being so unique, the patient outcomes and how thankful the patients are is really rewarding to just watch that personally. And I think that that's a really cool aspect of what your practice does and what you do, because it is so unique. So yeah, that patient outcome, I feel like walking away would feel really good in this practice. And so now, what does your practice look like now versus when you started? And you started in what year again? I thought when we last spoke about it, it was 8 years your practice has been open, but I might be incorrect about that.
Yeah, so I opened the door Cinco de Mayo 2018. So 6 years in private practice. Yeah. Initially when I first opened the practice, it was pretty much all of my focus in building the baby and making sure that the baby was a success. As the practice began to get more legs of its own, I wanted to figure out ways to optimize the practice that did not rely on my hands to make money. So, I added in some ancillary services like Shockwave, PEMF, a lot supplement lines, bracing, and some other things like that. And then, recently was able to finally add in 2 new providers to the practice as well. So initially, when I started, it was me, working clinically about 40 to 50 hours. And then on the management side of ownership, X amount of hours on top of that. Then over time, COVID really made me shift how I, managed and was involved with the practice, because we were shut down, for about 6 weeks, and I still paid my staff during that whole entire time. And so from that, I started to do different things. At that point, I started a real estate LLC and started to shift. I had downtime, and so I started to go into some other endeavors at that point in time. And during COVID, also went back and started teaching at Emory as well, which has been great, working with the residents and working with the residency program also. So my time commitment to the practice has significantly shifted down, and my other endeavors have kind of shifted up some as well, which is giving me a little bit better balance. Because it's a grind and you can get a little bit burnt out within the practice itself also. So having 2 new providers that just started really like a couple weeks ago is very pleasing and makes me kind of think that the future of the practice is going to be in good hands as we kind of transition as I'm going down to the Grand Cayman for a different role as well.
That moment in life, that COVID, 2020, when the world stopped, I was going to ask, what are some of the biggest struggles that you've been through since 2018 in starting this practice? But I know, and you've discussed with us earlier too, but, what was that like, I guess?
Yeah. Yeah, it was as everybody in the medical field experienced, it was scary. You didn't know what was going on. You didn't trust anybody. People coughing and breathing. You just wanted to get away from you, let alone, have people in your procedure suite or in your office trying to do procedures on them. And also from a liability standpoint, you wanted to make sure that you were protected from your staff. You were protected from not exposing your patients to yourself if you were ill or your family was ill. So it was a very scary time period and a lot of uncertainty. Nobody knew kind of what was what. As well as very difficult times. But I think it was very good for learning. It allowed us to approach things better. I feel like a little bit more efficiently as well. And I think most practices that survived, about 11% of private practices did not survive that whole time period. At least it was 11% the last time I checked. A lot of people did not, survive that. So, you had to approach it differently because a lot of people did lose a lot of their working capital, with trying to keep the business afloat when no revenue was coming in. The government stuff did help out a little bit with that, the PPP stuff and all that. So that helped a little bit. But, it was a significant hit, especially when you live in my world of cash pay procedures. It was definitely different. Yeah.
Would you say that was the biggest struggle you went through as an entrepreneur?
Yes. And the second biggest is staffing, not necessarily managing people, because I never really had an issue with that. I'm pretty laid back and try to take a pretty reasonable leadership style. But being the type of positions that you hire for in the medical office space is going to be a lot of younger employees that have primarily high school or lower level certificate-based equivalency training. And so they're relatively lower pay wages, right? So that was always probably the biggest struggle, was trying to find and keep good people that saw the value in the brand that you were building. Because, you can find anybody to come to work, but you can't really find people to actually work for the practice, and make it something more and have a vision and want to be a part of that vision for the long term. And which is cool. Like, it's not for everybody. And I always tell people, like, if it has to be right person, right job, and if this isn't right for you, let me help you to get to where you need to be at. I never have been the type of person that gets upset or holds it against somebody if they want to transition to something different. As long as they're not stealing from me, it's all good.
Yeah. So what do you look for in hiring someone?
Yeah, it depends on the role. I think that, you want to try to find a person that has personality and a skill set that complements a certain role, right? The right person and right job does not always coexist. So if I have in the past, if I hire somebody and it turns out even with the screening that we do, you can do personality tests and things like that. If it's still not the right fit, if they're not the right job for that person, but that person is the right fit for the organization, then I try to move the puzzle pieces around to see if I can still retain that person and put them in a position of success. as well. So you really don't know until they get on staff, because everybody has their representative when you meet them, right? It's not the truth, and it takes a couple months for the truth to really come out. So that's really the biggest thing, and giving people some grace, allowing people to fail a little bit, and as long as they show that they have the interest and the capacity to learn, I think it can always work out.
So, in discussing kind of the struggles, what have been the biggest highlights for you in this journey since 2018?
I think that probably the biggest highlights, one is always everybody, whether we say it or not, likes being recognized, right? And so having the recognition amongst my peers in the field as a thought leader or a leader within the field is probably one of the most rewarding things. And some of the people are my seniors and who are my and have been my mentors that actually refer patients to me now. So that's always rewarding. And then just the patient outcomes, to be honest with you, man, that always is a very rewarding and warming feeling, being able to get people some long-term good outcomes, for sure.
I know I'm with a really important attending or doctor when every single time I'm in either the procedure suite or a clinic room and they look at me and they're like, "You're really lucky, kid," because they're just like, "Oh, this doctor's treated me so well and they've, done things for me and I feel much better now." So that's, and that happened with you, and I was just with you for a day. So, how have you changed throughout this experience?
That's a good question. I think, COVID made me realize that I was working too much, and that I needed to be more present with my family, being that I have almost a bazillion kids. So that's probably one of the biggest things. And also that I have to reinforce barriers better with patients as well. So, because of the type of practice I have, most patients do have my cell phone number. And so, they text, they call sometime on the weekends and things like that. And I just learned to just ignore it. If it's not anything that's critical, then it's okay, I think, for a patient to text or something like that, but they also need to realize that should not be taken for granted, and to also just go through the proper channels, call the office, go through the queue, or email me. If it's something critical, by all means, pick up the phone and call for a lifeline. I'm happy to help. But I think that that's probably one of the things that I've learned over time, that, allow patients to respect boundaries as well.
And with that, in asking this question, is there anything you'll never compromise on? Is that maybe one of those things, or what did you tell yourself you would never compromise on when you first started the practice, or I suppose in large part just become a doctor?
Yeah, that's a good question. This is probably one of the things that patients hate and love about me at the same time, is that I'm often late. I often run late, right? And I always tell people that is when I'm in the room, is blinders on, right? Everybody gets the time that they need. And sometimes I've been in a room with a patient for 2 hours before. If the complexity of the case or the emotional support or the physical nature of the situation, if it's warranted, then you have to do what you have to do to be able to provide the quality of care that's needed, right? Because at the end of the day, when you carry the doctor moniker, the root origin Latin word is to teach. And so that's always my perspective, is that the patient should always leave the office feeling comfortable with more, knowing more than when they came in. So if it takes 20 minutes and we both reach a consensus that we're happy with the visit and they feel like they've gotten out of it what they need, then great. Sometimes that's not the case. So patients love it and they hate it. They appreciate it when it's their time, but when they're waiting, sometimes they don't like that.
So what restrictions have you been able to avoid, you think, by owning your own practice? What have you got around that you're like, oh, thank goodness, like I don't have to worry about that. Like I have my own thing going on. And then conversely, what things have you been restricted by that you may have not been restricted by in an academic setting, or, you know, a different, or maybe working for someone else?
Yeah, that's a good question. You know, owning my own practice has allowed me, especially being a concierge practice, to avoid a lot of the regulatory landscape of the insurance world. So I don't have to really worry about, you know, the different modifiers and qualifying things to bill for this level, if it's going to be denied, if it's going to be reimbursed, if I'm going to get audited. So I can just really focus in on the care and the quality care that I deem is necessary. I can modify the prices. If I feel like I want to give a 50% discount, I can do it. Or if I decide today, hey, going forward, everybody's paying $2,000 for an epidural, I can do it. So, you know, that's probably been the most beneficial thing. I think probably the thing that is difficult is that you're on an island sometimes. You don't really have the support that you need sometimes. You know, just bouncing clinical cases and scenarios, making sure you're staying up to date. You have to be very vigilant. And that's just kind of being in the solo private practice, which I have 2 providers on staff now. But, you know, initially, making sure that you're staying up to date and abreast on the current data, the trends within your field, going to the conferences, staying abreast on the literature as well. So,
yeah, having that network is something that's been nice to witness in an academic setting. And I know I've heard other people mention that too, being out in the private world is, you know, maybe they don't have journal club happening every week. And then I think just to, you know, wrap this up for us, if you were to start this journey all over again, what would you change, if anything at all?
Yeah, that's a great question. I would probably definitely try to decrease some of the startup costs, because I think that I can do it a lot more efficient now. I would probably even look at subleasing space in a Class A space as well, which would help decrease the startup cost significantly also. And maybe even doing a joint practice with like-minded providers, whether that be, you know, physical therapists, sports and recreational doctors, or even a Pilates or yoga group, something like that, more of a multidisciplinary type of setting would be kind of cool to do also. But otherwise, I think it's been great. You know, I've been very fortunate to have good staff, you know, not to have a large degree of turnover in the practice, have a lot of people that support me, and also still had the support from Emory, as well as somebody that did not do a traditional fellowship, that did a private practice fellowship and was able to come back and play ball with Emory on my own terms as a 1099 employee, faculty member, which is kind of, you know, one of one, kind of outside of the mold of the traditional approach. So yeah, it's been good.
Nice. Well, sir, thank you so much for taking the time out of your extremely busy day. Atlanta, Emory, we'll all miss you significantly. You were a great asset to the whole community, but thank you again. And as always, it's a pleasure.
My pleasure. Thank you so much, man. And keep doing what you're doing. And I know you got a bright future ahead of you.